Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. When we come back, we'll be on location at Sport and Spine Rehab in Rockville, Maryland, discussing effective treatments for a major problem that many of us suffer from, carpal tunnel syndrome, with the Washington, D.C. area's top doctor of chiropractic, Dr. Jay Greenstein. Dr. Greenstein received a postgraduate degree in sports chiropractic from the Logan College of Chiropractic, served as an associate to the official 1988 Olympic team doctor of chiropractic, and became the director of research for the American Chiropractic Association's Council on Sports Injuries and Physical Fitness. He, along with his organization, Sport and Spine Rehab, has also been a recommended provider for the National Football League Players Association and has been the official chiropractic provider for the Washington Redskins cheerleaders. Welcome, Dr. Greenstein.
Thanks, Rocco. It's good to be here.
Oh, it's our pleasure to have you back on with us. We've got a lot to talk about today.
Yes, we do.
And with that being said, however, if you can please begin by telling us what chiropractic care is and the types of issues it addresses, I would greatly appreciate it.
Chiropractic care in its purest sense really is a hands-on, drug-free approach to restoring normal biomechanics to the spine and extremities. We address a variety of neuromusculoskeletal conditions, everything from neck and back pain to carpal tunnel syndrome to headaches, shoulder and knee pain, ankle pain, you name it. If it's muscles, joints, or tendons, we're dealing with it.
Can you please tell us what sets your organization, Sport and Spine Rehab, apart from the others?
What we do is we combine chiropractic, spinal manipulation, physical therapy, and rehab in order to get the best outcomes for our patients. Chiropractic manipulation, exercise protocols through rehab, soft tissue techniques are all tools in a toolbox that we use to get the best outcome for whatever patients are suffering from.
I understand that this type of care is effective for the treatment of other issues such as carpal tunnel syndrome.
That's correct, Rocco. What most people call carpal tunnel syndrome is very problematic for Americans today. What's even more problematic is how rarely surgery ends their symptoms. Many times patients can have other problems along the neurologic pathway. Compression of nerves can occur in the spine, in the thoracic outlet, in the elbow, and even at the hand and wrist, or a combination of the above, something that we call double or triple crush syndromes. History and physical examination is very, very important. It gives us 90% of our information, but we can always refer the patient to our in-house physiatrist who can do other diagnostic testing to evaluate the exact location of nerve compression.
So it's very comprehensive and certainly sounds like there's a lot involved.
The key to appropriate treatment for this particular problem, the absolute key, is appropriate diagnosis, an accurate and full diagnosis.
We're now going to see the treatment of a patient with carpal tunnel syndrome.
One of the most important things that we do here at Sport and Spine Rehab is address patients' ergonomic issues, because many times those ergonomic issues, those chronic repetitive stresses to the body, are the cause or the instigating factors of these conditions, especially carpal tunnel. As you can see, Peg has her computer aligned perfectly. Although she's using a laptop, she does have a keyboard available on the desk to keep her elbows bent between 70 and 90 degrees and her wrists in the neutral position. Having the keyboard at that level decreases pressure on the wrists and the carpal tunnel. Also, by having the laptop elevated, it allows for the middle of the laptop screen to be at eye level, which is exactly what we want when the patient is sitting up straight with her back supported by a higher back chair. Again, the things that we want closest to her are the things that she's using most frequently, and that is the perfect posture position while working at a computer workstation. We do a tremendous amount of rehab, and we use a lot of different products to help these patients rehabilitate their conditions. And this is an example of Peg working to strengthen her wrist extensors and flexors. I'm going to demonstrate one of the soft tissue techniques that we do on the forearm and the wrist in order to release the area for the median nerve as it goes underneath some of these tight tissues. So we put patients through passive and or active ranges of motion, and we start stripping the muscles to reduce spasm and tension and adhesions. And that allows the nerve to go underneath that tissue a whole lot easier and reduce the compression that occurs. So we do a little bit in the elbow, and typically we'll do 8 to 10 passes. And then we'll also do the same at the area of the transverse carpal ligament where the median nerve goes through the carpal tunnel. And these are just two areas that I'm demonstrating, but typically with these patients, depending on what we're finding on the examination, we could possibly be working on multiple areas: neck, thoracic outlet, elbow, and wrist.
We're now back with Dr. Greenstein. That was certainly very interesting to see Peg go through some of the treatments that she just experienced there.
The treatment plan works, and patients typically will show a response, a positive response, within about 2 weeks. And depending on how long the patient has had the problem for, treatment times can last anywhere between 4 to 12 weeks. So there is a range, but the less areas of compression and the less chronic the condition is, in other words, if they get to see us sooner rather than later, the quicker the treatment time is.
What's the process that a patient would typically experience at one of your sport and spine rehab clinics?
If their symptoms are just in their hand and their neck, their shoulder, their elbow is not evaluated, we potentially could miss something. And that can be very, very detrimental to the outcome of the treatment. So our goal, again, is to make sure that we're evaluating the area of chief complaint, but also evaluating the associated areas to make sure that we're comprehensive in our evaluation process and we can identify the areas of compression and then relieve them.
We're now going to meet Peg, who's a patient of sport and spine rehab. Welcome, Peg.
Hi, it's really good to be here.
Now, let me begin, if I may, by asking you, did you suffer from a lot of pain prior to coming to sport and spine rehab?
I really did. I was in quite a bit of pain.
What type of treatments did you receive?
Well, I received a combination of chiropractic, physical therapy, and rehab treatment. They did soft tissue work and stretches, keep me going.
Have the treatments helped?
They've helped a lot. I'm able to do my job easier. I'm in a lot less pain. It's been a real good experience for me.
Well, that sounds great, and I'm very happy to hear that. And on that note, I'd like to thank you, Peg, for joining us and being a guest on A New Me.
Thank you.
We're now back with Dr. Greenstein. Peg certainly seemed very pleased with the results.
She had an excellent outcome, and that's what we want for all of our patients, and that's what we strive for every day.
Are patients generally cured if they finish their course of treatment?
Not only do patients get better, Rocco, but they're more functional and better educated. This prevents reoccurrence. And although we can't cure everyone, they have improved functionality and a better awareness of their bodies.
How safe are these treatments?
Not only are these treatments safe, they're effective. Furthermore, they're incredibly more safe than any surgery that a patient would have on their wrist.
Now, we've only got a few moments left, Dr. Greenstein, and I have to ask you if there are any final thoughts that you'd like to share with all of us.
We need to identify the problem, we need to fix the problem, and we need to make sure the problem doesn't come back. And that's our goal. So we want our patients to be able to work better, play harder.
Well, on that note, I certainly want to thank you, Dr. Greenstein, for joining us today. I would definitely say it was very helpful and informative, and certainly lets us know of some other options that are out there for all of us carpal tunnel sufferers.